Just last year, overdoses created 48,000 deaths. To me, that number is stunning. In 2016, life expectancy in the United States has fallen for the third year, largely due to opioid-related overdose deaths. And the economic costs are just unbelievable, $700 billion a year. One of the reasons it grew so large, I'm told, is the lack of education among medical professionals, which has led to overprescribing. And so we saw in many cases, pharmacies were pill mills, with some churning out of millions of pills to smaller communities, regardless of medical necessity. Opioid manufacturers and distributors, I believe, had a responsibility to identify and report these suspicious orders, but they did not. This problem was compounded by inadequate responses from the federal, the state, and local governments. The Trump administration declared the opioid epidemic a public health emergency in 2017, but has only used 3 of the 17 authorities triggered by that declaration, limiting its effect. The Office of National Drug Control Policy, ONDCP, failed to issue national drug control strategies in 2017 and 2018. Its 2019 strategy did not include concrete goals for a 5-year projection for program and budget priorities, both of which are required by law. And according to the October 2019 Department of Justice IG report, the Justice Department and DEA did not initially use all of their existing authorities and resources, reduce quotas for opioids, or hold registrants adequately accountable. The result was an opioid epidemic that evolved from prescription drugs to heroin and ultimately to fentanyl. And there's little question in my mind that the initial response to the opioid situation was ineffective. So how do we get back on track? I very much believe that any solution must include a whole of government approach, and we've got to use all available resources. The Comprehensive Addiction and Recovery Act, enacted in 2016, laid the foundation for this approach. Another bill, the Support Act, was signed into law last year. It built on the 2016 legislation by authorizing critical agencies, as well as prevention, treatment, recovery, and enforcement programs, and expanding research. This act also included a provision called the Using Data to Prevent Opioid Diversion. This part of the law is designed to ensure that opioid manufacturers and distributors are held criminally and civilly liable for identifying and reporting suspicious orders of opioids. I happen to be the one that authored that, and I'm very much concerned that it's never been really enforced. So today, I'm introducing new legislation to strengthen this law. And this legislation will require data on all controlled substances to be reported, not just opioids, in order to better identify suspicious orders. It will also require pharmacies to report all transfers of controlled substances to the DEA each month. There is so much to do. The federal government has begun to do this. ONDCP has established a number of interagency working groups, including the National Opioids and Synthetics Coordination Group, big name, to monitor emerging trends and data. The Justice Department created the Opioid Enforcement and Prevention Efforts Division, and that's an opioid fraud and abuse detection unit under a new initiative known as J-Code, focused on disrupting the online sale of illicit drugs. For its part, DEA has increased its tactical diversion squads, enforcement, and administrative actions against negligent distributors and manufacturers. So as a result of these efforts, for the first time since 1990, prescription drug-related overdose deaths decreased. That's really good news. So there are things that we can do to save life and reduce addiction. The Centers for Disease Control and Prevention has warned us a fourth wave of drug overdose epidemics is upon us. Most of those suffering from addiction, they tell us, use more than just opioids. In 2018, cocaine, methamphetamine, and benzodiazepines were present in nearly 60% of all opioid-related overdose deaths. That's a stunning figure to me. So we've got to take a good look at it and see what we need to do. And I would encourage our witnesses today to comment on this. And if you have a solution or thoughts, I think we'd be very interested in hearing them. Our country has been ravaged by an addiction epidemic, and it costs tens of thousands of lives every year. So failure should not be an option. So this is an important hearing, and I so look forward to hearing from our witnesses, hopefully with new ideas and constructive thought.